Recording in progress.
Hello, everyone. We'll give maybe another minute or two to let others join us. All right, we'll go ahead and get started. Thank you for joining us for Orthopedic Specialty in Sports Medicine's quarterly educational webinar on heel pain explained, simple solutions for plantar fasciitis. Tonight's speaker is Dr. Tung Dao, OSSM foot and ankle surgeon. Dr. Dao is a highly skilled, fellowship-trained foot and ankle surgeon who grew up here in Ohio and is proud to serve the residents of Licking County. He completed his advanced fellowship training at the prestigious Silicon Valley Reconstructive Foot and Ankle Fellowship in Mountain View, California, and his foot and ankle surgery residency at Grant Medical Center right here in Columbus. Dr. Dao earned his doctorate of podiatric medicine degree from Kent State University College of Podiatric Medicine. His surgical expertise includes ankle arthroscopy, minimally invasive bunion surgery, total ankle replacement, flat foot and cavus foot reconstruction, as well as comprehensive care for foot and ankle fractures and sports-related injuries. Please type any questions you have in the Q&A box below, and Dr. Dao will answer questions following his presentation. Dr. Dao, you're on.
Hi, everyone. Thanks for joining us this evening. Taking the time to learn more about plantar fasciitis and common treatment options for this very common disease. And thank you, Renee, for the introduction. So let's see here. All right. So as Renee said, from Stowe, Ohio, trained at in Columbus. I did my fellowship in California and currently practice at orthopedic specialist in sports medicine in Granville. So the outline for today's presentation include talking about the background involving plantar fasciitis. What is it? Why is it painful? Some risk factors. When to see a doctor for this. The type of tests and imaging studies that we order for this. Some simple treatments you can try at home. When do you need advanced treatment? The timeline for recovery. When is surgery needed? And some key takeaways. So plantar fasciitis is the number one cause of heel pain. And about 1 in 10 people will develop plantar fasciitis, and more than 2 million Americans seek treatment for this every year. A common misconception that I hear is, I'm not very active. I'm pretty sedentary. I work a desk job. But even sedentary, people can develop plantar fasciitis, not just, the active runners. This is most commonly seen in patients, between the age of 40 and 60. However, it's been reported that even children as young as 7 can develop plantar fasciitis. So it's not just something that you see with increasing age. So what is the plantar fascia? It's a thick band of tissue that goes from your heel bone all the way towards the balls of your foot and acts as a shock absorber and supports the arch. So when you walk, what happens is that it stabilizes your foot and tightens with each step. And this common question I get is, why is it painful? Well, plantar fasciitis is painful because what happens is that with repetitive stress to the plantar fascia, It causes tiny tears in that tissue where it attaches to the heel bone, and this can lead to pain and stiffness. So, what are some common risk factors for developing plantar fasciitis? Folks who are overweight are 5 to 6 times more likely to develop plantar fasciitis. Those who stand all day at work, 4 times increased risk of getting it. And people with really tight calves can develop plantar fasciitis, and we'll kind of dive into that a little later on, which is it's a very important concept. And in any sudden increase in your activity, like starting training for a race or just starting to work out after taking a long period of a long break from working out. What do people commonly experience when they have plantar fasciitis? Most of the time, it's like a sharp stabbing pain on the bottom of the heel that you experience during the first step when you get out of bed in the morning or after periods of inactivity. Sometimes it can feel like a burning pain or an aching and throbbing pain. And usually does get better as you walk around, but it may return if you're inactive for a period of time. It tends to be Your heel tends to be tender on the bottom of the heel, but sometimes it's also in the arch because the plantar fascia goes from the heel bone all the way towards the toes. So, when should you see a doctor? A good time to see a doctor is when you've tried some simple treatment options, which I'll talk about in the next slide. And these treatments haven't provided any relief after a course of a few weeks, or if the pain is very severe, don't wait. Go ahead and get that evaluated to make sure it's something other than plantar fasciitis. When you come to the doctor's office, sometimes we order x-rays to make sure that it's not a stress fracture of the heel bone, which is very rare but can occur, especially in those who increase their level of activity, start training for a marathon, or start working out more intensely. We rarely need MRIs for plantar fasciitis just because it's so easily diagnosed on clinical exam and kind of hearing their story about what the symptoms are. However, MRI is a good option if there is concern for a stress fracture that isn't obvious on X-rays, or the doctor is concerned about something else that's not seen in X-ray. So, what can you try at home? And this is kind of a bullet point list of all the treatment options you can try at home, and I'll dive into each one here shortly. But it starts off with some stretching and strengthening exercises. You can use some ice, water ball massages, activity modification. You can try over-the-counter shoe inserts, or see your doctor to get a prescription for custom shoe inserts. Wearing better shoes, taping techniques for the foot. You can wear a night splint, or try anti-inflammatories like ibuprofen. So the biggest thing that I kind of harp on with plantar fasciitis is stretching and strengthening. So there's a lot of research out there that the plantar fascia is connected to the Achilles tendon and the calf, through the heel bone, and also the hamstrings are shown to be involved and can contribute to problems with plantar fasciitis. So starting from the top down, starting with the hamstring, and these are some easy hamstring exercises you can do. Sitting in a chair, stretching out your leg and pointing your toes towards you while leaning forward. Um, a very important type of stretch is this calf stretching exercise. It's called a eccentric calf stretching, where you kind of stand on the edge of the step with your heels hanging off the edge. You go up on both heels, lift up one leg, and then slowly lower your heel until it goes just past the edge. The most important part of this stretch is going slowly down on your heel. Doing this about 2 or 3 times a day, maybe 15 repetitions or more. And then this is an easy calf stretch you can do where you just lean towards the wall, both feet flat in the ground, and kind of hold this stretch until you feel that burn in the calf. It takes about like 20 seconds to get to that point. You can do it 2 to 3 times a day. And then another good stretch is a plantar fascia stretch, where you kind of cross your leg over and pull your foot towards your shin and then pull your big toe towards your shin at the same time, and you can start to feel that plantar fascia in your arch. Um, Another thing you can do while doing this stretch is massage your plantar fascia with your thumb, and that can help with pain. Aside from stretching exercises, some things that you should also do is strengthening exercises. It's been shown through research that strengthening the musculature in your foot can really help with plantar fasciitis. An easy one to do is some toe curls, putting a towel on the floor and scrunch up the towel of your toes. And on top of scrunching, you can kind of extend your toes as well. And another exercise is called doming, where basically you're kind of resting your foot on the floor and you're trying to push your big toe into the ground and keeping it flat and raising an arch. It's a very subtle kind of movement, but it's very effective. Other things you can do include the ice water ball massage. Wear a sock to keep a layer between the ice and your skin, and just kind of roll it from the heels all the way towards the balls of your foot. Um, the picture on the bottom there shows a taping technique, which is a little more involved. There's some good YouTube videos on how to do this. It's called low dye taping, but it's not as common anymore. Um, Getting some good shoe inserts, like those Power Step shoe inserts, you can get from Amazon for $40. They work really well, and people experience pain relief in a matter of days once they start wearing some good supportive shoe inserts. In the top right corner, there's a night splint that you can wear. Um, not a lot of patients, enjoy wearing this at bedtime. It can be kind of uncomfortable, but it can be an effective option if you've tried these other treatment options and you still have pain. Another thing you can do besides using an ice water bottle to massage your plantar fascia is using a tennis ball. So, we talked about calf stretching. Why is that important? It's important because your plantar fascia, the structure in the bottom of your foot, is connected to your Achilles tendon through the heel bone. The heel bone is kind of like a bridge, and you need to be able to pull your foot up towards your shin a certain range of motion, about 10 degrees, to walk normal. And so when your calves are tight, your Achilles tendon pulls up on your heel bone. And in order to get your foot flat in the ground, your arch collapses and that stretches your plantar fascia like a bunch of rubber bands and develops tension and strain. And then eventually you start to develop these little micro tears in your plantar fascia, usually towards the origin of the plantar fascia where it attaches onto the heel bone, where a lot of people experience pain. So, what do you need? When should you consider other advanced treatment options if you tried all the things I mentioned earlier and you still have pain? Well, you can try steroid injections. Those are generally covered by insurance. You'll get pain relief for about a month to 6 months potentially. Trying to it will get you through the initial pain, so you can get through doing the exercises and stretches without having intense pain. Platelet-rich plasma injections are a good option. It tends to be very pricey, as you can see by these $3 signs compared to the other options, because it's self-pay, it's not covered by insurance, as it's considered experimental. But there's some good research out there that shows that it's an effective option where your blood is kind of drawn in the office, it gets separated, and you get this platelet-rich layer that has a lot of healing properties, and it's injected into the painful part of your plantar fascia to kind of re-kickstart the healing process. Shockwave therapy is a good option too. It's a lot cheaper than platelet-rich plasma injections. It can take a couple sessions, maybe 3 or 4, and it's the same idea where it uses high pressure sound waves to re-kickstart the healing process, because the plantar fasciitis, you know, the pain is persistent because it just doesn't want to heal. And so the shockwave therapy kind of tricks your body into thinking that's a new injury. And so kind of encourages the healing. And then laser therapy is kind of the same concept, where it uses certain wavelengths of light to stimulate the cells in the area of pain to kind of heal itself. So, what should you expect with the recovery timeline? Well, the good news is that a lot of plantar fasciitis goes away with the easy treatments, as I mentioned earlier. About 90% of patients with plantar fasciitis experience pain relief with conservative treatment. About 80% improve within 12 months, but I've seen patients improve in a matter of 3 to 6 weeks. Um, However, symptoms can persist, but as long as you're consistent with your stretching routine and other treatments, you'll continue to improve, even though the progress feels really slow at times. So when is surgery needed? Well, it's rarely needed, and it's something that we consider if you failed conservative treatment, 6 to 12 months of conservative therapy. Um, the success rates of surgery for plantar fasciitis is very good. However, it does take time to recover. Usually, it takes about 2 weeks of being non-weight bearing, and eventually, slowly kind of getting back to full weight bearing in normal shoes after about two weeks. There's two different ways to address this. It's making cutting a portion of the plantar fascia, which is called a plantar fasciotomy, through a minimally invasive incision or about a centimeter long incision near the bottom of the heel to release the tension of the plantar fascia, providing pain relief. But there's also a lot of good research that suggests that addressing the root cause of the tightness of the plantar fascia at the level of the calf, which is very tight, by cutting the ribbon-like layer where the arrow is pointing, this white layer right here in far right. That's called the gastrocnemius aponeurosis, and it's kind of like a thin film that's when it's cut through a minimally invasive incision, it can help lengthen the calf. And recovery is about 2 weeks of non-weight bearing and followed by progressive weight bearing in normal shoes. So, surgery is rarely needed, but when it's indicated, the results are good. So, some key takeaways: plantar fasciitis is treatable. Most people get better. Just start simple. The first line of treatments are inserts, stretching, and strengthening exercises. Be patient, consistent. Know when to get help, and stay hopeful, as there are many effective treatment options out there for this. So that's everything. I appreciate everyone for joining us tonight for this presentation. We have a orthopedic walk-in clinic in the office in Granville. They can come in any time. If you have any questions, feel free to give us a call. And thank you so much for joining us tonight. And with that being said, I'll take any questions that you folks may have.
Dr. Dao, we have a question. Do heel spurs cause plantar fasciitis?
That's a great question. It's a really common question I get all the time when I show patients their x-rays. They see the heel spur. The heel spur is only present in plantar fasciitis patients about half the time. You can have plantar fasciitis pain and not have a heel spur. Folks used to shave the heel spur down to treat plantar fasciitis, but the pain would return. But no, the heel spur doesn't cause the pain. It's the micro tears at the plantar fascia that causes pain.
Another question. I've been resting, but my pain hasn't gone away.
Yes, another good question. Even sedentary patients can develop plantar fasciitis, not just the active patients. And so, even if though you're resting, you still have to do the stretching and the strengthening exercises, and especially trying, those some good inserts.
And that leads us to the next question. Do the expensive custom inserts really work?
They do work, but if you've tried the cheaper alternative, like the $40 inserts on Amazon, and they provide you great pain relief, then that's really all you need. But if you notice that those shoe inserts start to be less effective over time, then custom, shoe inserts would be a good option for you because you know that inserts help, and then getting custom ones made for your feet will certainly help even more.
Great. Well, thank you all for participating in tonight's webinar. We hope you enjoyed the presentation and it was helpful to you. Enjoy the rest of your night. And if you'd like to learn more from Dr. Dao or schedule an appointment, We have all the information on the screen, and you can give us a call. Thank you very much. Have a great night.
All right. Thanks, everyone. Have a good night.